Okay, this is Chapter 6 of the Community ATI, Aggregates in the Community. Aggregates are groups that have a common characteristic. Aggregates or target populations can be defined based on special interests or geographic locations. Identify aggregates when planning or targeted health interventions. Aggregates receive services from community health nurses. These include individuals from infancy to death, families, and group within the community. Children, this is birth to 12 years, and adolescents. The income level of caregivers affect the children in many ways. Children living in families who have low income status can face low food security, are at risk for homelessness, and might have difficulty learning and developing cognitively. Access to care is another concern for children. Legislation such as the Affordable Care Act and programs like Medicaid and the Children's Health Insurance Plan promote access to care for children who might face health disparity. Health concerns and leading causes of death. Children, perinatal conditions and congenital anomalies, sudden unexplained death, motor vehicle and other unintentional injuries, infant mortality associated with maternal health, socioeconomic status, and access to medical care. Adolescents is motor vehicle and other unintentional injuries, homicide, and suicide. Screenings and preventative services. Children, height and weight, vision and hearing, dental health, immunization status, lead exposure, cholesterol and triglyceride levels, nutrition assessment, and physical activity assessment. Adolescents is height and weight, vision and hearing, dental, rubella serology and immunization history, substance use disorders including tobacco, immunization status, mental health screenings, cholesterol and triglyceride levels, nutritional assessment, and physical activity assessment. National health goals. For children, it's reductions in dental caries, obesity, and infant mortality, and exposure to secondhand smoke. Increases in newborn blood clot spot screenings and follow-up testing, access to medical home, schools that require health education, childhood immunizations, use of child safety restraints, physical activity, the number of infants who are breastfed. Adolescents, the reductions for the national health goals is reductions in violent crimes, use of alcohol, marijuana, and illicit drugs, deaths related to motor vehicle crashes, and mental health concerns, and increases in schools with breakfast program, participation in extracurricular activities, wellness checkups, and physical activity. Community education. Children is anticipatory guidance, breastfeeding, sleeping positions, physical activity, injury prevention, helmet use, poison control, CPR training. Adolescence is anticipatory guidance, substance use disorders, sexual behavior, nutrition, especially calcium intake from female clients, injury prevention, including car, fire, and firearm safety. Adult health can be influenced by many factors. The genetic makeup of each sex can increase the risk for certain diseases. The environment is an influence with societal and cultural expectations for gender influencing the risk of disease and whether interventions for prevention and treatment of disease are valued. Most social determinants of health on the major health concerns for adults are related to chronic conditions rather than infectious diseases. While screening recommendations are generalized for the aggregate, the nurse should also consider individual client factors when suggesting screenings. Despite large expenditures on health, life expectancy for adults in the United States is lower than many other developed countries. Health concerns and leading causes of death. Heart disease, diabetes, mental health, sexually transmitted infections, colorectal cancer, stroke, obesity. Females is reproductive health, menopause, preconception counseling, and malignant neoplasm and osteoporosis. For males, it's unintentional injuries, erectile dysfunction, and malignant neoplasm. Older adults. The percentage of older adults compared to general population continues to increase and is the fastest growing aggregate in the United States population. The proportion of older adults living alone has continued to increase. The community nurse should ensure clients living alone have access to the healthcare services and assistance needed. About 1/3 of the medications prescribed in the United States are for older adult clients. Most older adults have at least one chronic health concern. Many have more than one, with some being particularly vulnerable due to age-related changes in physiological functioning and decreased ability to recover from illness or injury. The family has a client Family as a client is basic to community-oriented nursing practice. Community health nurses have a significant role to play in promoting healthy families. A family consists of individuals who identify themselves as family members and have interdependent relationship that provides emotional, financial, and/or physical support. There are numerous structures and forms families can choose to take. Community health nurses must engage in community assessment, planning, development, and evaluation activities that are focused on family issues. Home visits provide community health nurses with the opportunity to observe the home environment and to identify barriers and support to health risk reduction. Approaches. So the nurse can take several different approaches to the nursing care of a family. Family as a component of society, that's where the nurse monitors how families interact with other institutions in the community. It's used to study and implement population-focused interventions such as immunization campaigns for a disadvantaged population. Family as a system, this study shows how interactions among family members affect the whole family function. It's used to promote family health by directing interventions toward the family by the way the family interacts with each other. The family as a client examines the family unit functionality first, then individual needs next. It's used to see how the family health is impacted by each individual's reaction to the health event. And family as context. This focuses on an individual first and the family next, used to promote the health and recovery of an individual, using the family as a resource for service and support. Crisis and transitions. Family crisis occurs when a family is not able to cope with an event. The family's resources are inadequate for the demands of the situation. Transitions are times of risk for families. Transitions include birth or adoption of a child, death of a family member, child moving out of the home, marriage of a child, major illness, divorce, and loss of the main family income. These transitions require families to change behaviors, make new decisions, relocate family roles, learn new skills, and learn to use new resources. Characteristics of healthy families. Members communicate well and listen to each other. There is affirmation and support for all members. Members teach respect for others. There is a sense of trust. Members play and share humor together. Members interact with one another. Members participate in leisure activities together. There is a shared sense of responsibility. There are traditions and rituals. Members seek help for their problems.